Go live.
Good evening, doctors. Welcome to this webinar on carbetocin in action. Doctors, as you all know, carbetocin is a drug which is used in prophylactic management of PPH, prophylaxis of PPH. And PPH, we all know how serious it is. It can potentially lead to disaster. Although there are many papers and many guidelines which suggest the use of carbetocin in PPH prevention, we always like to get our own doctors' insights, our own KOL insights on use of carbetocin in PPH. For that, today we have got Dr. Brijbala Tiwari as our speaker, will share her experience and her case studies on use of carbetocin in PPH. Dr. Brijbala Tiwari is chairperson-elect, Foxy Environmental Health Committee. Madam is consulting gynecologist and infertility specialist, credential menopause practitioner, is managing director of Life Care Hospital, Centennial Hospital and Test Tube Baby Center and HCH Nursing Academy. Past president of Indore OBGY Society, Vice President of Indore Menopause Chapter, past Vice President IMA, Secretary ISO PABRB Chapter Indore, Joint Secretary MPISR 2020 to 24, past Secretary IMA 18 to 19, Organizing Secretary AMPOG 17, Organizing Joint Secretary AICOG 22, Organizing Joint Secretary ISR 2023, PCP NDT representative to district government. Madam has organized many live surgical workshops with faculty in national and international conference. Dr. Tiwari is recipient of CS Don Best Paper Award in AICOG 2014, Isar Dronacharya Award 2023, MS Signature Award, and IOG. With this introduction, Madam, I welcome you to this webinar to share your experience. And now over to you.
Thank you so much for this kind introduction. And
You can share your screen.
is it visible?
Yeah, it is. Now it's not. No, now it is not.
Okay.
The first one. Yeah.
Okay, fine. So basically, PPH is one of the nightmare for any obstetrician.
Your presentation is not seen, Madam.
It's not?
No, only your desktop is, your folder is seen, but not the presentation.
But your screen sharing is written over here.
Jen, can you help, Madam?
Okay, I will share again.
Jen?
Is it now?
No, Madam. What we see is only the screen and folders along with it, the files along with it. Please, can you see the screen? Madam's
Is it visible?
No, Jen, can you help, Madam?
Now?
No.
No?
No.
So, just a moment. Share screen. You had given me share screen option.
Okay.
And
Go to the Zoom meeting. Here, there, a green color icon will be there. Share. Then
yeah,
click that, and then
Right.
share entire screen.
from the Zoom, I'm sharing.
Actually, you share the window only.
Okay, just a moment. So I need to go back to.
Now click the share icon.
The green one.
Is it now?
Now click on this. See if it opens.
Is it?
No, Madam.
Still not?
Only single window was visible. Like it's in a folder, file manager.
Mm-hmm. From here, I can see that I am sharing. There are two buttons now. You are sharing screen or there is stop share screen. So,
Once
but
stop the sharing,
okay,
And you
stop.
open this file, separately open this file and then start sharing.
first open the file.
Yeah, it's open now.
Now
Yeah,
start sharing.
now click the share icon.
Now there is no
You
share.
will get, yeah, you will get the options like share entire screen, share the window, like that. So click the share entire screen.
You want me to share, madam? I have your case studies.
I think better you.
I will
I
talk,
don't
madam.
know what happening today.
It's okay, these things.
Yeah.
I will share, madam, because you have to leave also, otherwise. Well, madam, I'll share. Now go to case studies.
Prashant, please let me know when you are ready. I will start the recording.
You can see the case studies, madam.
Yes, I can
Jen,
see.
so we are starting. Huh?
Okay, start. You can start.
So, basically, PPH is nightmare for any obstetrician. Although we are delivering day in and day out patients, but sometimes even the low risk patient can turn into high risk due to excessive postpartum bleeding. So here we are using like long back we used to use oxytocin only since many 4 5 years we started using carbetocin, and here I am sharing few studies in some a very low risk patient like she's 30-year G2P1 with 39-week pregnancy, and there was no any complication, and patient underwent vaginal delivery. And delivery was, as I am saying, that it was uncomplicated, but once patient delivered, there was gush of bleeding, and so we started IV oxytocin, 5 international unit and 10 unit infusion, but and everything was done like care bundle um, approach, massage, and call for help. Everything was done, but bleeding was not controlled. So carbetocin was given, and immediately patient responded. And can you forward, please? So simultaneously, we were doing everything like sending her blood samples, and once we started carbetocin, patient's uterus contracted very well, and blood loss was reduced. And so, this is very effective molecule. In spite of using oxytocin, patient was bleeding, but once we had given carbetocin, her uterus contracted and patient vitals were maintained. So this was very low risk patient, and we used after oxytocin, and patient responded well. Next, please. So similarly, this is one more case. Like we know that PIH is very common in very young primary and elderly primary. So here is a patient. She was diagnosed as PIH and her BP was 150/96. Otherwise, vitals were normal, and her blood parameters were quite okay. Platelet was slightly on lower side, but it was in the normal range. And she was taken for emergency LSCS because one twin was transverse and one was breech. So here it was, we were knowing that she is a high risk case. So we had started carbetocin for the active management of first stage of labor after delivering the babies. Next, please. So she responded well, and we have not used any other drug except that carbetocin. So here is one more patient. She is elderly primary, and she had history of one missed abortion, and there was a fibroid, subserous fibroid, class 3 fibroid, intermammary fibroid 8 by 8 centimeter, and placenta was low lying, and she was on progesterone support because she was on risk of having preterm labor, and she was also GDM diagnosed during pregnancy, gestational diabetes, and she asked to do take rest because of this low lying placenta, and she was taken for elective LSCS because of this um, fibroid, elderly, and conceived with difficulty. So in this case, it was planned to use carbetocin, and this patient delivered 2.9 kg baby, and she was well maintained with carbetocin for prevention of PPH. So routinely we are using nowadays in low risk and for prophylaxis in high risk patients, and in low risk if there is need for any control of PPH. So these are my few cases. Otherwise, we are routinely using. Can we go forward?
Yeah, thanks, madam, for these cases. Now, some of the questions, on what is about your use of carbetocin? What is your experience? You said you have been using for past 3 years or so, no?
So basically, many times when we were using oxytocin, because we used to use it for induction, and same
Correct.
we route we
Correct.
are using at third stage. But many times we used to observe that in spite of giving 10 units, 20 units, uterus is flabby, not responding. So we found that the major concern is the cold chain maintenance, because in the
Ah,
transportation,
yeah,
the
yeah.
medical shop, it was not so effective
Right.
uh, working. So once we started using carbetocin, particularly in high risk cases, we are quite comfortable. So it is not having any more side effects like with prostadine and misoprost. So it is not having that type of side effects, and it is we are comfortable. Single dose and quite effective.
One important point you mentioned is maintaining of cold chain, which is required for oxytocin. This is, suppose, a major advantage, especially in interiors, where we do
Yes,
have, even in place like Mumbai, we have a lot of power shortage. I mean, image some off and on. And
exactly.
yeah,
And out of 12 months, at least 8, 9 months, we are having hot temperature in India. So,
in Mumbai, we have got only two temperatures, hot and very hot. There is no other.
right.
What is the patient profile where doctors can anticipate a PPH?
Like mostly high risk patients like nowadays IVF pregnancy, elderly mothers are there, high BMI is
Yes.
there. Many times this fibroid is there, twin multifetal gestation, and previous section there is low-lying placenta or placenta accreta syndrome is there. So these are known cases where we anticipate the patient is going to a big size baby, GDM mother, PIH, preeclampsia, anemic mothers. So these are the patient profile where we anticipate that this patient is going to have
PPH.
PPH.
And of
But
course, as they
patient
always
is
say,
not, yeah,
as they always say, expect the unexpected. Despite knowing all this, sometimes these patients may not have, but someone unexpected, like your case one, I mean, a normal patient suddenly landing into PPH. These things are. But
mm,
patients with diabetes, are they more predisposed or more prone to get PPH? I'm not
best.
talking about gestational diabetes, patient with routine diabetic mellitus.
Yes, gestational diabetes is also very
Yes.
not uncommon, we can say, because India is
Yeah, yeah,
diabetic capital, and during gestational period they come out to be
yeah.
diabetic.
Yeah.
And with diabetic, there is big size baby sometimes.
Yes, yes.
PIH is associated. They are obese as well. They are elderly as well. So there are these are the patient profile. So they are having more risk of
Yeah.
PPA.
Where will you prefer carbetocin or oxytocin for prevention? I mean, you
Uh,
almost answered this question, but anything
I
else you
think,
would
yeah.
want to add? Yes.
Uh, Probably like whatever indication we have discussed previously,
Yes, yes.
more or less same. And we have more confidence now on carbetocin because either you are giving, because it is having long half-life and sustained contractions is there, and it is heat stable. So basically we prefer
And as
nowadays.
you rightly said, in the interiors where there could be a problem of cold chain, there could be a problem of nursing staff, giving a single dose injection anytime practically is more preferred as compared to IV infusion and multiple dosing and unknown effect at the end of it.
Right, right.
Can we use carbetocin in case of retained placenta?
Yes, nowadays, because sometimes it is leaking, and previously, previous seizure, there is a low-lying placenta and all that. So, because it is not like ergometrin sort of a mechanism is not. Initially, there is transient contraction there, then there is sustained. So, we are using for this also.
And ergometrin is more of a lower segment contraction, unlike
Yes.
yes. We use carbetocin in Rh negative mothers?
Yeah.
There should not be. Like
Yeah.
oxytocin is routinely used.
Yeah.
If a doctor uses oxytocin for induction, can the doctor use carbetocin for prevention of PPH if the need arises?
Uh, yes, we can switch over to, because for induction we are using oxytocin many times,
It's a
and the
textbook
patient
brand
is
ultimately.
yeah, and in that patient, if she's prone for this PPH, we can switch over to carbetocin because it is its half-life is more, so it is working for a longer time.
Longer time. Is there any specific what route do you normally prefer, IV or IM?
Like this is both the routes are very fast acting, but when we need very fast action and patient is already on IV, slow IV push in 1 minute we can do. Otherwise, if we are not having good nursing staff, and that we can use IM as
IM
well.
also, yes, yes. So whenever there is a need for urgent and immediate action, IV would also be preferred. And whenever there's a facility of anesthetics.
Right.
Yeah.
Skilled staff is there, then we
Yes,
can.
great stuff. If patient is not responding adequately with carbetocin, which could happen sometimes, what additional uterine tonics would you suggest?
So it depends on patient profile. If there is no contraindication of any this prostadine. So,
Asthma, etc.
so yeah, if patient is not asthmatic or not having any drug reaction, or if patient is not hypertensive,
Hypertensive, yes. Then you can use any one of them. And coming to the side, I mean, I'll come to that question later. What are the advantages of carbetocin over oxytocin? You have already said misoprostol, carboprost, and methyl ergometry.
so it is very like we can say inner drug not having so much contraindication. Like carboprost, if we are using patient is full stomach, she will vomit or she will have loose motions. With misoprost, there will be shivering and temperature. So that's why these are the advantages
And a
of the
golden
side.
moment of her life, getting this side effects is not so good. And methyl ergometry, one thing, with oxytocin, it is said to be ADH effect because of then there's a water retention, etc. How commonly have you seen this effect with oxytocin?
Actually, not not so much.
Because they say now it has got action
Because it
similar
is
to,
not so
yes.
long acting, so
The action
frankly not
not
seen.
commonly seen. Should carbetocin be kept as a reserve drug? I mean, you people are using it as a first line. There's no question about you keeping it as a reserve.
I think I prefer nowadays with carbetocin because we have more confidence single dose, not much of contraindication, and
In
if we
all,
compare cost, even we are giving oxytocin in drip,
yes,
so
yes,
we
yes.
have to monitor. So I
Correct, correct.
think this is
And do you use it every patient or you use where there is a risk? Carbetocin,
like in all high risk we are
high
using,
risk patients.
but once we are delivering baby and if patient is already induced with oxytocin, then we continue with the same.
Same.
Some more 5 unit we add to the drip. But if there is gush of blood is there
Oh,
and
yeah.
uterus is not contracted and there is no this thing.
If you suspect atony, maybe you will push in carbetocin. How would you compare adverse effect profile, especially over, because all these trials have showed they are similarly effective, but in terms of adverse effects, carbetocin scores or
Like
I mean, practical approach, carbetocin scores. So how would you could compare side effect of carbetocin vis-a-vis oxytocin?
just you have to observe vitals only, tachycardia and all that.
That's it. Have you seen any adverse effect with carbetocin in these 2-3 years of use?
Mm, uh, probably not.
That's wonderful. That's very reassuring. And your one-liner on carbetocin use in PPH. Take-home message, as we say.
I think this is now a nowadays drug of choice for most of the obstetrician
Correct.
because of the safety and tolerability both.
That was all, madam. Thank you so much for your insights. I'm sure the participating doctors must have benefited. What happens, rather than having those guidelines and papers, our own doctors' experience is anytime better. I mean, it gives them reassurance and it gives them insights into the use of a drug. So thank you once again for this presentation, your insights, your case studies. I'm sure it must have benefited the audience. Thanks all the audience for taking time and attending this. Thank you, marketing team Hitro for conceptualizing. Thank you, field personnel of Hitro for support. Last but not the least, thank you, IT team for your continuous backup support. Thanks all of you. Signing off. Thank you very once again. Wish you a very pleasant evening. Signing off. Thank you.
Thank you so much. It was
Thank
nice.
you. Thank you so much, Doctor, for pulling out time and having a
Yeah.
wonderful session.
Thank
Thank you.
you. Thank you. Bye bye.
Okay. Ma'am, we'll connect